Hi, everyone. Thank you for joining us for today's webinar. My name is Jake Davison, and I'm the National Sales Rep here at Forte Elements. Forte Elements is a science and research-based company with condition-specific nutritional supplements. We work closely with athletic trainers, dietitians, and doctors, providing products to help repair and recover from injury. Our topic today is on fractures, presented by Dr. Kirt Kimball, orthopedic surgeon and team doctor for Brigham Young University. We were very excited to have him here. We don't have this opportunity very often, so it's good to have you. If you have any questions during these presentations, please type them into the question box in your GoToWebinar control panel, and we will also have time for some questions at the end. We're going to turn the time over to Dr. Kimball now for the fracture webinar.
Good morning, everybody. Happy to be here and to talk to you about fracture healing and the unique role of nutrition, which really begins with the story behind Forte Elements and how it began in the first place. This is a picture of a fracture that was sustained by one of our five-star recruits about 5 years ago. And I can tell you his name now because he's now with the 49ers. This was Fred Warner. And he's given us permission to share his story because it was his fracture. And I'm sure many of you, especially if you're in D1 football, you sustain fractures in some of your athletes, and you confront your physician with the typical question of, gee, is there any way to get this guy or this gal better faster from the given fracture? And in Fred's case, this fracture was a non-displaced lamina fracture. One would expect it to heal uneventfully. It didn't need surgery. It didn't need anything unique, but the pressure was, can't you get it to heal faster? And that led to actually a rather open-minded approach to the existing literature as to alternative methods of fracture healing. Fractures are a big deal. We'll get into the details of how to make them heal faster in the course of this discussion. But we know that about 6 million Americans break a bone within their lifetime. It's responsible for a huge number of emergency room visits. And whether it's you or your buddy, just about everybody will, in the course of their lifetime, sustain at least 2 fractures. And you can probably look in your own history and recognize that you've already participated and you're already a statistic, as are many of your athletes. Of course, emergency room visits responsible or that are provoked by sports-related injuries. When we look at who actually goes to the emergency room, number 2 on the list are fractures after strains and sprains and major ligament injuries. So it's a common event. It occurs in all parts of the body. And as I'm sure each of you look back at your own history with your own athletes, then certain things jump to the surface in terms of which ones are the most common. This is a study that was done on collegiate athletes. And it was looked at NC2A athletes over the course of a 10-year period, and saw that overall there were about 100 or so fractures reported each year, about 1,000 over the course of this 10-year period. Of course, many were not reported. But at least within this study, you probably can recognize these statistics. 34% were hand injuries, 17% were fibular fractures, and as you look back at your own experience, I'm sure that as it has been mine, the hand surgeons and the foot and ankle surgeons tend to be the busiest in terms of fractures related to sports. More importantly, a majority of the fractures resulted in, of course, at least 3 weeks lost from participation, and of course, many of them much, much more than that. And about 1/3 of them require surgery, and of course, some of them are recurrent. We're going to talk briefly about fracture healing because if we understand the mechanisms at play, it's easier to understand how nutrition and other mechanical forces may play a role in recovery. We look at fracture healing in 3 phases: the inflammatory, the reparative, and the remodeling phase. If we look at the inflammatory phase first, just for a moment, I've kind of highlighted blood clot formation. You break a bone, it bleeds, you form a clot. And many of us are very conversant in PRP and the application of platelet-rich plasma. Well, quite frankly, that's what is happening here. The clot forms, platelets are aggregated at the fracture site. those platelets rupture and release a variety of hormones and other unique proteins that trigger what happens in the inflammatory phase. There's a cleanup process to remove dead cells and injured proteins and other elements from the fracture site. I'm sure you're all familiar with the cleanup process. If you've ever seen an athlete fall on an outstretched hand, have pain over the carpal navicular, and get an x-ray and it's normal, and then a couple of weeks later it still hurts and you get a new x-ray and you find there was a fracture line there. Well, in retrospect, the fracture line was there all the time. You just couldn't see it. And it's not the problem with the skill of the radiology. It's just that the cleanup process initially removes bone and other debris from the fracture site and makes the fracture more apparent on x-ray. And so a couple of weeks later, you realize that, oops, it wasn't a sprained wrist, it was a fractured navicular. And hopefully you don't have to play catch up. But anyway, there's an inflammatory cascade that occurs and it triggers a number of things, including the triggering and the creation of osteoblasts, which are cells that make bone, chondroblasts that make cartilage, and then the osteoclasts, which are the ones that, frankly, are the scavengers, and they remove the debris and clean up the fracture site. A couple of weeks into the process, you get into the reparative phase, where protein is produced by the osteoblasts and the chondroblasts to, in effect, create what we call a soft callus. And so a couple of weeks into it, the fracture starts to become more stable. And that process can take anywhere from 6 to 12 weeks, depending on what the resources are that are available to make that process proceed forward. And this is going to be really important as we talk about the role of nutrition in recovery. And then the final phase, after the fracture is stable and you've got this primitive or woven bone that has stabilized the ends of the bone, then gradually over time, there's a process of remodeling that converts that primitive bone into lamellar bone, which is the real strong bone. And in many cases, it is stronger at the fracture site than before the fracture occurred because of the additional bone that has formed. So some of the nutritional demands of fracture healing, we can kind of summarize it in kind of 4 different areas in terms of what's happening. One, there's a dramatic increase in energy needs. There's a dramatic increase in protein need, increased blood supply to the area. And then we have to deal with the issue of free radicals and the role of antioxidants. And so we'll kind of talk briefly about these areas. Protein, interestingly, makes up about half of the bone by volume. We think of bone as being a mineral or calcium and other elements, but in reality, half of it is protein, and bones to some degree are flexible. You put a load on them, they tend to bend. If you exceed the modulus of elasticity of that bone, then it's going to fracture. And the protein needs to make a bone heal are rather dramatic and unique. And we know which amino acids are those that are important in forming new bone matrix. Lysine, arginine, proline, glycine, cysteine, glutamine. We know these guys are important and play a unique role in forming bone matrix. Interestingly, we all know that IGF-1 is a banned substance with respect to the NC2A, but likewise, it's not banned if your own body produces it. It's a very, very powerful protein or polypeptide that really dramatically increases skeletal strength, integrity, muscle strength. And if you give an athlete amino acids to stimulate fracture healing, it also stimulates endogenous IGF formation, which makes the whole process work even better. Now, if you are protein deficient, you get crummy callus. It's rubbery instead of rigid. And the formation of the callus itself is delayed because it doesn't have the substrate or the protein or amino acids necessary to make the process work. And in some cases may contribute to a non-union. And even a modest amount of amino acids, 10 to 20 grams a day, has been shown to significantly accelerate fracture healing. So protein supplement is really important in any fracture healing, and especially if somebody happens to have a low baseline at the time of the fracture. But I think it's important. Many of us think that our athletes are well nourished, and in many cases that's true. But the nutritional demands of that athlete go up dramatically when his or her body has to deal with a fracture or recovery from a similar traumatic incident. Let's talk about free radicals for a minute. When a bone breaks, we think of it as a mechanical event, and indeed it is. But at a microscopic level, collagen fibers are broken. And when those broken fibers interact with oxygen, they create free radicals. And free radicals, to put it in the terms of an orthopedic surgeon, they're bad guys. It's like rust on your boat. It delays, it damages the integrity of the metal. In this case, it really upsets the healing process, and your body knows that, and it is capable of responding to free radicals by bringing antioxidants to the area. So what are those? Well, vitamin C is a really important antioxidant. Vitamin E, lycopene, alpha lipoic acid, these and others play a very important role in suppressing the destructive effects of those free radicals. And what's interesting, if you look at vitamin C levels in an individual who has sustained a major fracture, their vitamin C levels plummet rapidly, just within the first 2 or 3 days. And so you might think that you've got plenty of vitamin C on board, and maybe you do, but within a day or two, you don't. And your body is not capable of storing vitamin C to any great degree, and it certainly can't make vitamin C. And so you need to make sure that C and E and some of these other antioxidants are there in sufficient quantities if you want to help your body suppress the destructive effects of those free radicals. Most people, they come to the emergency room with a strained sprain or even a fracture, they're often given NSAIDs for pain relief and the well-intended thoughts of let's reduce the pain, swelling, and inflammation. You'll feel better sooner. And frankly, that's true. You will feel better sooner. However, when a fracture occurs, prostaglandins are released. And prostaglandins are really important in the recovery process and in the inflammatory cascade. And among other things, those prostaglandins trigger the release of COX-1 and COX-2 enzymes. And those are really important in the inflammatory phase. Well, NSAIDs suppress the action of those enzymes. And so at a critical point when you've got a fracture and you want the inflammatory cascade to move forward uninhibited, then all of a sudden you throw some ibuprofen or some indocin or some naproxen or any, diclofenac, there's a whole bunch of them. If you throw those at the fracture, then you're slowing the whole process down. And that's without even considering the fact that NSAIDs are dangerous. 100,000 hospitalizations a year just from NSAIDs, and 16,000 people die every year in the US just from the use of drugs like ibuprofen and naproxen and indocin, et cetera, et cetera. So when you see that acute fracture, leave the ibuprofen in your pocket. You are not going to do that fracture any good by throwing those agents at the individual. Now, there are natural anti-inflammatories that can actually accelerate fracture healing, can make the athlete or individual with the fracture feel better, can reduce pain and swelling, but not have a negative impact on those important enzymes. What are they? Vitamin C, omega-3 fatty acids, quercetin is a bioflavonoid, and there's some other bioflavonoids. These are natural anti-inflammatory agents. They are beneficial, like your ibuprofen would be, but they don't have the negative side effects. So if you want to make a fracture heal faster, you have to realize that fracture healing is an extremely complex process that involves a wide range of nutrients. there isn't just one magic button. I'm going to walk through those briefly. This is the list of the ones that we know are really important in fracture healing. And I'll talk about each one for a brief moment. Zinc, copper, calcium, phosphorus, silicon, vitamins B, C, D, and K. Some of these, of course, you're going to say, oh, yeah, I knew that. Calcium, vitamin D. Others, perhaps not at the top of your list. But in many cases, some of these that you may be less familiar with are actually even more important than some of the ones that you are familiar with. Okay, mineral bone, 50% by volume. It's 70% of its weight is made up of minerals. And we all know that the body is very aggressive in trying to make fractures heal. And the system will go steal minerals from other parts of your body to facilitate fracture healing. So on an acute basis, you might think, well, I don't have to be in a hurry to provide appropriate minerals. And to some degree, you're right. But the body's going to do that at the expense of the rest of your skeleton. And so you need to think a little bit broader in terms of not only facilitating fracture healing, but supporting the skeleton long term. Zinc is a really important mineral. We know it plays a valuable role in at least 200 different enzymes. It does aid in callus formation, enhances bone protein production, and there's really good data, good studies showing that independently it does stimulate fracture healing. So that's an easy one. Copper, we know it's really important in collagen formation. Again, 50% of that bone by volume is protein, and collagen makes up a substantial part of that structure. Collagen fibers that are then used as the infrastructure within a mineral content. And there's good studies that show that the demand of the body for copper and zinc go up dramatically after a major trauma or fracture. And the more serious the fracture or the trauma, the greater the body's need for copper and zinc. Vitamin C, we've talked about that a lot. You can cure your cold with it. We all know those important roles, but you may have not thought about it as much with respect to fracture healing. Really good data that you get stronger, more effective callus if you have adequate vitamin C. Why? It's an important antioxidant. It suppresses those free radicals that we talked about. It reduces pain and swelling. But more importantly, it's really essential for the synthesis of bone collagen protein matrix. And as I said before, your body doesn't produce vitamin C, and you will tend to utilize your existing stores within a few days after a major trauma, unless you are replacing it supplementally. Vitamin D, of course, we always know and think about vitamin D with respect to bone and fracture healing. It's the principal regulator of calcium absorption. We know that if you're low in vitamin D levels, your fracture healing will be suboptimal. We also know that about 70% of North Americans are low in vitamin D. You might not be, your athletes may not be. You may feel like everybody is taking some vitamin D and their levels are appropriate. But what you may not think about is they may have adequate vitamin D today, but if they break their femur tomorrow, then all of a sudden their need for vitamin D goes through the roof. And they may be in a good starting position, but you've got to look at the healing process now, wherein that additional vitamin D is going to really be important. They may heal without it, but we know that mineralization of the callus is substantially accelerated if they have adequate vitamin D. Interestingly, vitamin D plays an important role with vitamin K in terms of transforming stem cells at the fracture site to become osteoblasts. Stem cells are a hot topic for all of us lately. And we think, anytime there's an injury, an incident, or event, at least in my neighborhood, everybody's saying, well, what about stem cells? Should we throw stem cells at this? Would that make a difference? And I think what's important to realize is that fracture sites trigger cellular migration. Fracture events trigger endogenous stem cell formation. If you've got vitamin D and vitamin K around, it helps the body transition those stem cells into becoming osteoblasts. So you really don't have to go looking for stem cells somewhere else. They're there. You can support them in their change into a bone forming cell. So a number of vitamins are necessary. We've mentioned several of them. Vitamin K doesn't get talked about much, but it's really essential in binding calcium to bone. Important in bone protein formation. We know that if you don't have it in sufficient quantities, that calcium doesn't get incorporated. And we know independently it has a beneficial effect on fracture healing and in terms of the strength of the collagen and the tissue. We also know that if you look at fracture sites, the body's pretty smart. It knows vitamin K is important. Vitamin K tends to be concentrated physiologically at the fracture site. We'll talk about B12 for a minute. B12 seems to play an important role along with vitamin K in fracture healing. And there's some good animal studies showing that individuals that are low in B6, did I say B12 or B6? Anyway, I said them both. We're talking about B6 right now. We'll talk about B12 later. But we know that animals that are deficient in B6 have more frequent fractures and their healing is compromised. So when we look at the big picture, nutrition is really an important aspect of recovery, and you can make a dramatic impact on it. There are mechanical factors as well. And we know that through appropriate physical therapy, sequential loading of fracture sites, rehabilitating appropriately in the course of the healing process, we know that bones respond in part to the stresses that are applied to them. And that applies to the healing process as well. And so in certain fractures, repetitive loading through structured exercises can likewise augment the recovery process. So just a brief comment on a few of the studies that have already been done that validate what we've been talking about. There was a Swedish hip fracture study published in 2006. They looked at complications rates, and these are older people with broken hips. And they looked at those that had supplemental nutritional therapy versus those who did not. The group that did not had a 70% complication rate. Those that were supplemented with nutritional therapy, only a 15% complication rate. That's pretty dramatic. And they took that information and did a meta-analysis looking at 17 other hip fracture studies and demonstrated that those that received aggressive oral nutritional supplementation, the death and complication rate was reduced by 50%. So the science is really valid in terms of the impact of nutrition on fracture healing. This study was done in Germany. It was a multi-nutrient study looking at tibia fractures. All of us know that if you have a tibial shaft fracture, that's a difficult fracture to heal. Sometimes they take months and months. Many go to non-unions. Many require surgery. And that's a fracture you really don't want to get. Well, they looked at comparative study, the placebo group, 11% of them healed in 10 weeks. 33% of the group that were given nutritional supplementation healed in 10 weeks. So that's pretty dramatic. If you can knock 2 or 3 or 4 weeks off the healing time of a fracture, whether you're an athlete or a breadwinner or just anybody, to get better faster by using something simple and safe by augmenting fracture healing can really make an impact on your life. So what did Forte Elements do? They developed a multi-nutrient metaceutical grade fracture product to help bring together the science that we've been talking about. In other words, put in a delivery model all of the information that we've just been reviewing. This is what it looks like. Comes in a box, a month's supply. We've got 30 packets. It contains vitamins, minerals, amino acids, trace elements to accelerate fracture healing, all the things we've been talking about. It also contains a couple of bioflavonoids, quercetin and bromelain, Those are those natural anti-inflammatories, so they feel better faster. If you were experienced with it last year, you know that it's pretty medicinal. It didn't taste all that great. You'll be excited to see the new version, which I tried it the other day. It tastes like the Nestle's Quick that I am accustomed to doing just personally. So I think you'll like the flavor changes. There's also a number of tricks that you can employ to make it taste better, to get it down. But what you need to, I think, emphasize to those with fractures is this is medicinal. It's effective. It's going to help you get better faster. It's not an energy drink, but it plays a very important role. And the value of doing it may be that you get better faster. We at Forte Elements get a lot of anecdotal reports of positive experiences. We thought we'd just show a few of them, and then I'll answer some of the questions that have been coming in. This is a D1 volleyball player, broke her small finger. You can see it on the left on day one. It's an unstable fracture, and of course surgery was talked about. It was right at an important part in the season, and for a number of reasons, it was elected not to operate on it, but just put it in a splint, put her on the fracture product. And although it was anticipated a 4 to 6 week healing time, she was playing again in 2 weeks with a splint. And you might ask, well, is it healed in 2 weeks? And I'd say, no, it's not healed in 2 weeks, but maybe that rubbery callus advanced at a more rapid rate. Maybe the natural anti-inflammatories more effectively reduce pain and swelling. The net effect is it got her back into the game. This we received from the mom of a hockey player, another hand injury. This athlete had sustained a similar fracture the year before and was out for about 6 weeks. This time, a similar fracture in another finger, and this time using Forte Element supplementation, was back in 2.5 weeks. Again, is it healed in 2.5 weeks? I don't think anybody would expect that it is, but that early stage of reparative phase of advanced soft tissue and soft callus formation advanced to the point where the affected digit was more functional, such that the athlete could return to play. Here's one that came from Western Kentucky, scaphoid fracture, similar to what I'd been talking about before. This one had surgery, took the fracture product, the fracture line was obliterated, and he was back playing in 5 weeks. Some of these responses have been impressive and really dramatic and really exciting. But at the same time, once you understand the biology, it's also really predictable. This was a case we saw early on in the early days of the fracture product that's very illustrative of what can happen at a fracture site. This was a patient with a hip fracture. Excuse me. This is a subtrochanteric femur fracture you see on the left of your screen. It was fixed by one of my partners. And you might be a little critical saying that, well, it's not perfectly aligned and there's still a gap at the fracture site. But if you've ever fixed these fractures, you know they're really, really hard to fix. And they also have a very high likelihood of not healing, as did this one. So in the next x-ray in September, you can see that the fracture's not really healing. Actually, what happened between 1 and 2 is it didn't heal. And as a result, one of my other partners, who's a complex fracture specialist, he took out the rod, he put in a compression plate, he bone grafted it. And then a few months later, he found that that didn't make it heal either. And so now we've got 2 major operations. We've got a non-union twice. And the contemplation was a 3rd operation now to try and make this heal. Instead, Forte Element's fracture was employed for a period of 2 months. And it's pretty dramatic to see the amount of callus formation between January and April, realizing there were 8 weeks of Forte's fracture product in between. Here's a report that came from NC State. This was Justin Smith. Thanks, Justin, if you're listening. Just reporting his experience with a number of fractures over the year. In many universities around the country, we see that this product is becoming standard fare. In this particular case, it was a non-surgical tibial plateau fracture, estimated 10 weeks of recovery, was back in pads in 6 weeks. And that's frankly consistent with the data that we see out of other studies looking at the impact of nutritional support on fracture recovery. At BYU, we've had a number of experiences. Unique in one athlete was a fifth Met fracture, Jones fracture in one foot that was treated just in a standard fashion, took him 10 to 12 weeks to heal, had to redshirt the year because of it. Next year, he gets the same fracture in the other foot. This was treated differently, of course, given the prolonged recovery on the first one. The athlete was treated surgically, put a screw in it, put him on Forte fracture, and was back competing in 6 weeks. Certainly, I'm sure the surgery had a role. Being a surgeon, we like to think our part's the most important part, but the fracture supplement is critically important as well. We had another athlete with a fracture of his mid forearm that was actually plated and was progressing to a non-union after 3 months. The plates were in place, everything looked good, the fracture just wouldn't heal. Put on fracture, on Forte's fracture product, and within 8 weeks, then it was solid and he was healed. And lastly, we have one from Drew Wolf, University of Georgia, just representing their experience with a lot of different fractures over the last few years that they've been pleasantly surprised with the response that they've seen. While I've been wandering along here, there's been a number of questions that have come in. So if it's okay, I'm going to kind of walk through. You have those in front of you, Jake? Okay. So let me see here. So what do you recommend for treating stress reactions and stress fractures? That's a really good question. If you look at Forte Elements products, you will see that there is also a bone product. And that product is designed differently than the fracture product. The bone product is designed to augment and support the nutrition and strength of bone. It's really important in the aging individual who might be losing bone through other processes, but it's also important in the athlete who is exposing their bone to repetitive stress. So if I have an athlete who has an acute stress fracture, one, I'll put them on fracture until it's healed, the Forte fracture product, and then I'll usually put them on Forte's bone product at least for the next few months, just to further augment their bone nutrition. Now, what about the stress reaction where they have bone pain, x-ray is normal, you get an MRI, you see some subtle surface periosteal reactive changes, not sufficient to call it a stress fracture. What do I do in that situation? Frankly, I treat it like a fracture. In my mind, it's a pre-stress fracture. And if I want that athlete, they're usually cross-country and track athletes that get those. I'll put them on fracture for 3 or 4 weeks and then put them on bone, again, to augment those. Now, if I have a high-risk group, like, say, the women's cross-country team, we know, and those of you that are engaged in that sport know that in the course of a year, you're going to have a predictable number of stress reactions and stress fractures. I mean, you can almost book on it. If you want to dramatically reduce the likelihood of those occurring, put them on Forte bone. If somebody does have then an acute reaction, then load them up more aggressively with Forte fracture and then continue to support them. So how long does an athlete, there's another question, how long does an athlete with a fracture need to take the product? I take it till it's healed. The fracture comes in a 1-month box. I think you'll find in the majority of your situations, 1 month is all you need. In some cases, more complex fractures, dense shaft fractures like a femur mid-shaft fracture, a tibia mid-shaft fracture, then certainly you're probably going to need it for a couple of months. So if my athlete's already taken a multivitamin, do they need to stop that while they're taking the product? Well, what I would suggest you do, in most cases, it probably won't matter. If they're taking a daily multivitamin, and if you take a look at what's in that daily multivitamin, you'll probably see that there's not very much in it. And so it may have little or no impact But if you're concerned about it, just have them stop. What about those with low bone density or osteoporosis? Is this a good product for them to take? Well, at the D1 athlete level, those that are going to have low bone density are more than likely to be in your female population for a number of hormonal reasons. In those individuals where it's a defined medical condition, sometimes there are prescription grade interventions that are appropriate in managing severe low bone density and osteoporosis. And in other places where it's not to that degree, then I would default to Forte's bone product rather than the fracture product. The fracture product is very intense. It's a big deal. It's about 50 grams of stuff a day, all designed to make that fracture heal. It's medicinal, even though the guys at Forte have made it so it tastes pretty good now, but it's medicinal and it's aggressive, and take it when you need it. If you don't need it, don't take it. So what about somebody with a history of multiple fractures? Would this product help prevent fractures in the future? I think if you have somebody with multiple fractures, you need to look at them from the internal medicine perspective. Maybe you need to do some bone density studies. Maybe you need to do some more aggressive biochemical interventions in terms of defining what some of their deficiencies may be, or maybe they have some other illness or condition that's contributing to that. So I wouldn't arbitrarily feel like that you can intervene in this fashion with a supplement. The supplement may be very valuable in dealing with this condition, but I think you have to kind of step back and see, am I missing a medical diagnosis in this individual who seems to have multiple fractures? What is the most important element in fracture healing? That's a good question. And to be quite frank, my answer would be all of the above. Is there a magic pill or a magic button that you can push that is a single item? Is it calcium? Is it vitamin D? Is it a certain amino acid? And I think it would be nice to have that kind of an answer, but there isn't one. The answer is that fracture healing is a very complex biochemical process that requires a myriad of nutritional components. And if you want to take advantage of the existing science, you kind of need to throw the whole bucket at the fracture. So if my athlete is not vitamin D deficient, is this product necessary? Well, one, I would challenge the first premise. There may be some athletes that are not D deficient, but we know with recent studies that about 70% of North Americans are D deficient. They're D deficient because everybody uses sunblock. They're D deficient because our diets have moved away from that. It's nice we don't get skin cancer anymore. Instead, we have vitamin D deficiency. So that's great if you're not D deficient, but I think it's safer to assume that most athletes are. But I think more importantly is if you have a fracture, then it's great that you're not D deficient at the time of the fracture, but I can assure you that within a few days, you will be relatively D deficient in terms of the fracture site needing dramatic amounts of additional vitamin D to support the process. Have you completed any studies on your product or this specific formula? The answer is absolutely not. Forte Elements' agenda is to take the existing science and formulate it into a product or a delivery model to enable you, the athletic trainer, or the patient to bring the science of nutrition to whatever that condition is. So every element in Forte Elements fracture, and it's consistent with other Forte products as well, those elements are in the product because each of those elements independently have been shown to be very effective in accomplishing the task that we're focused on. In this case, the fracture product, every element in there has been either jointly or independently been demonstrated to be extremely important in fracture healing and to independently play a role in accelerating fracture healing. So at Forte Elements, they haven't invented anything new. They have merely taken the existing science and packaged it into a delivery model so that you, the patient, can take a packet out of a box, mix it up and drink it, and apply the current science of nutritional support for fracture healing, or nutritional support for nerve injury recovery, or nutritional support for mitigating brain injury in the athlete that is at risk for brain injury, or for the athlete that's trying to recover from major surgery more rapidly. The term metaceutical was developed by Forte Elements. A metaceutical is a product, a nutritional product that is developed for a condition, a very specific condition, in this case fracture, wherein the elements in that product are validated by peer-reviewed published data, and the product is manufactured in an FDA quality facility, and in our case, an NSF certified facility that also meets FDA dosing standards, so that you, the consumer, can say what's on the label is actually in the bottle, and the science behind that product is validated, published, peer-reviewed, and you're welcome to go on the Forte Elements website and get access to white papers that, to a very detailed extent, alliterate the bibliography, the resource material, the weeds, if you will, behind each of these products. What athletes are at the greatest risk to sustain a fracture? Well, if you've been in the business a while, you know. Certainly the women track athletes, great risk for stress fracture and stress reactions for a myriad of reasons. The collision athletes, you know who they are. In many cases, the fractures, despite all of our efforts with equipment and conditioning and training, happen anyway. And so our role is to help them get better and get back in the game. Last one here. What's the best way to move forward with ordering this product? I think there's a slide. Well, you can go to forteelements.com. Jake Davison, gentleman who introduced me, you can reach out to him at his at this website email address. I know that Jake will be sending out this PowerPoint in a YouTube format, so that if you're not here listening to it now, you can listen to it later and gain access to it. Any other questions come in, Jake?
No. Is that all you wanted to cover? Is there anything else?
I think I burned through it.
Awesome. Well, thank you, everyone. We really appreciate you being here, and be aware of that white paper that he was talking about. We have that here in your handouts tab. It's available to you to print off. If you'd like a copy, just let me know. I'll send all of you that joined an email with a link. We're just going to crop it into a video so it's convenient for you. So if you would like to order any of the product or have any other questions, reach out to myself or Garrett, and we'll get you taken care of. So if that's it, we'll finish it up here. Thanks, guys.